Shigella infection, Shigellosis. The Shigella infection, they are also called the Shigellosis. This is a condition that affects your digestive system. The bacteria causes possible bloody diarrhea. Washing your hands frequently with soap and water is a key to prevent the spread of this infection. So, let us see what is the Shigella infection. This is caused by the Shigella bacteria. This is a disease that affects your digestive system. It produces the stomach pain, diarrhea, and fever in the people who are infected. Shigella is very contagious. There are the various types in the Shigella bacteria group. You can get shigellosis by eating the contaminated food or drinking the contaminated water. If you swim in the contaminated water, you may get the shigellosis by accidentally swallowing the water that you are swimming in. Shigella infection is a type of the food poisoning, may also be called the bacillary dysentery. This is a word for the diarrhea that contains the blood or mucus. Anyone can be infected with the Shigella, but it often occurs in the regions with poor sanitation or in the crowded place, such as schools, daycare centers, and the nursing homes. Younger children are more likely to be infected because they often put their hands in their mouth. Shigellosis is a worldwide problem with about 188 million cases per year that result in about 1 million deaths per year. In the developed countries, like in the US, there are approximately 450,000 cases every year. Shigella bacteria, they are caused by stool, feces of people who are infected. The bacteria are spread when someone comes in contact with the stool of an infected person or comes into contact with the item that has been contaminated with the stool or the bacteria. They get shigellosis by eating the food or drinking the water that has been contaminated or through the sexual contact with the infected person. Many different foods can be contaminated, but Shigella is found typically in the uncooked vegetables or shellfish. What are the symptoms of the Shigella infection? The common signs and symptoms of the shigellosis include the diarrhea, which can be watery, bloody, or contain the mucus of us. Stomach pain and cramps also cause the vomiting and fever. In some cases, the people who are infected with the Shigella bacteria don't have the symptoms but are still contagious. How is shigellosis diagnosed? Your provider may diagnose you with the Shigella infection on the basis of your symptoms. However, testing the stool sample for the presence of the bacteria will let you know for sure. Diarrhea and the bloody diarrhea can differ from the number of diseases. Confirm the Shigella infection involves taking a sample of a stool to be tested in the lab for the presence of Shigella bacteria or the toxins. Risk factors. Being a child, children under the age of 5 are most likely to get the Shigella infection, but the Shigella can infect the people of any age. Living in the group housing or participating in the group activities, close contact with other people who are infected, like the Shigella outbreaks are more common in the child care centers, community bathing pools, nursing homes. Living on the traveling in the areas that lack the sanitation, and being a man who has sex with men. Men who have sex with a men are at the higher risk of Shigella infection because of direct or indirect oral anal contact during the sexual activity. Here we can look for the complications or the side effects. They can cause the dehydration because of the diarrhea. This condition can be very dangerous for elderly people and babies. Sometimes infection with the Shigella bacteria can produce this complication. A bloodstream infection, seizures in the children, and post-infection arthritis, which is also called the Reta syndrome or the reactive arthritis. If you develop this after the shigellosis, you will have the itchy joints, irritated eyes, and pain when you urinate the pee. Hemolytic uremic syndrome, a condition that affects the small bloody vessels that can cause the anemia. You can lessen your risk of getting or spreading the shigellosis in the following ways. Wash your hands with soap and water thoroughly and often, especially before and after eating. Wash the food well and cook them well. Avoid swallowing water in pools. Throw away the spoiled diapers in the garbage. Follow the safe food and water instructions when traveling in other countries. Here we can look for the treatment. Over-the-counter drugs. Talk to your doctor before taking the OTC drug intended to treat the diarrhea. Diarrhea can be caused by the number of conditions, and OTC drugs may take some conditions first. If a lab test has confirmed that you have the Shigella infection, an OTC drug containing the bismuth subsalicylate, Pepto-Bismol, may help decrease the frequency of your stools and shorten the length of your illness. However, it isn't recommended for children, pregnant women, or people who are allergic to aspirin. Avoid taking the OTC, the anti-motility drugs such as the loperamide, Imodium, and drugs containing the combination of the atropine. These aren't recommended for the Shigella infection because they can decrease your body's ability to clear the bacteria and make your condition worse. Antibiotics for severe Shigella infection. Antibiotics may shorten the length of the illness. However, some Shigella bacteria have become the drug resistant, so your doctor may not recommend the antibiotics. Fluid and the salt replacement. For generally the healthy adults, drinking water may be enough to be counteract the dehydrating effects of the diarrhea. Children may benefit from an oral dehydration solution such as Pedialyte available in the drugstores. Many pharmacies carry the one brands. Children and the adults who are severely dehydrated need the treatment in the hospital emergency room where they can dissolve the salt and the fluid through a vein. Shigellosis or the infection with the Shigella bacteria causes the watery and possibly bloody diarrhea. The best way to prevent getting or spreading the Shigella is to follow the good hand washing practices. Contact a healthcare provider if you are in the extreme pain or have the high fever. You can rest at home and keep drinking the fluids like water to stay hydrated. You may need antibiotics, but most people recover completely from the shigellosis. Thank you.